My name is Darren Benike. I'm from Castle, South Dakota. I work at Esteline Community Oil Co-op in Esteline, South Dakota. I'm the general manager there. I was diagnosed with COVID-19 on October 24th. I spent 7 days in the hospital here in Brookings, South Dakota. Things weren't going well, so I was then transferred via helicopter to the Vera Clinic or hospital in Sioux Falls. I spent 10 days in the ICU there. Then I was transferred out of that into a regular room for a couple of days. They thought it was going to take a little longer, so then they transferred me back up to Brookings. And I spent another couple of days here before my lungs actually got to a point, my body got to a point where it could handle the oxygen and I could go home with the support that was required. They thought getting me there would provide a little bit better level of care if I continued to not improve or if I started to get worse. Then I get on the helicopter and I'm thinking, well, this is kind of a cool ride. I remember thinking that, and I could see out and stuff, and all of a sudden, poof, we're down in a hurry. And, I thought, oh, I'm feeling good, everything's good. The nurses on that helicopter were fantastic, or whatever they are. They pulled me off of there, and we're in a hurry. And I remember it being a little cold outside. I thought, gosh, this feels good to breathe in this air. And all of a sudden, boom, we're back inside and we're up, and they got me on the bed and they're testing everything out. And okay, well, this is getting real. This can't be good. I didn't know that my wife had been talking to these folks behind the scenes and had arranged this with them. It instantly became as real as it could get when the ICU doctor came in and talked to me. It got real scary, I'm telling you. Like I said, you're a grown man. I can take care of this myself. I'm a big boy. I wasn't. At that point in time, it was very humbling. And I about lost it. It was tough. But after that second day, that night, Doc saw me and said, okay, looks like, you're still stable. It's not going backwards. So I think we're okay. He said, but this could be a little bit of a long road. I need you to be patient. And I'm like, that's the last thing I want to hear. I've already been here for 8 days. And I mean, he was cool about it. But at the time, I remember I was still kind of irritated, right? Because, I don't want to be in that situation. I'm a big boy. I can handle myself. But you think about a couple of the moments that I had, and then it starts to come to you, and then finally I just kind of gave up and said, you know what, it is what it is. Whatever it takes, I'll just stay here. And so my whole prerogative changed at about day 3 or 4 in that ICU, to where I finally said, you know what, I'm not getting out of here on my own. It's not working. My lungs aren't there. I guess I may as well sit here and work through this, because it's not getting any better otherwise. So it's the alternative, I thought at that time, was bad, which is not being around. And so I thought, all right, let's do this. Let's fight it out and see what we can do. So I was in ICU for 10 days down there. Finally, we're making progress that I can understand. I had my appetite back. It seemed like things, like I was getting better. And so, then they were looking for a room closer to home, which was Castlewood. And so they said, well, would you be willing to go back to Brookings? I said, oh, absolutely. That's what was really cool. That was a tearjerker for me. Because when I got back here, everybody was awesome. The nurses are, like, whoa, what, you're back? And a couple of them explained they didn't expect to see me back. So that was still tough. But yeah, they were all really good. Giddy. They were chuckling, laughing, telling me some of the stories, filling in some of the blanks that I didn't have. And I thought, this is kind of neat. I didn't know any of them from a hole in the ground, really. And they were cool. My recovery is going fantastic. I actually started breathing on my own. I could sit in my chair in the house without the oxygen on for a pretty long period of time before I would get below 90%. It's like, okay, I feel good enough. I'm going to go try to get back to work. And when I walked in, I didn't tell anybody I was coming, of course. And I walked in and I'm like, what in the world? And I didn't know I had maybe lost 50 pounds as well. So I maybe looked a little different. And they're all trying to talk. They're like, oh my God. So then we had our moments. And, I thought, okay, going through all this, I'm probably going to lose my breath again and stuff. And I sat down and I checked it and did the breathing techniques, and they work. It's crazy. Doctors do know what they're saying. There's no question the answer to this question, because I have a whole new appreciation for the medical staff, for the nurses and doctors. It didn't matter who you are, what you are, how stubborn I was. They knew what they needed to do, and everybody, nurses, I don't know whoever it was, the receptionist folks, doc, everybody was fantastic. Like I said, I was a little foggy on some of it, and I don't remember all of it, but even with the state I was in, which I think maybe I was a little belligerent might be the word. I was a little stubborn, a little ornery with some folks. They didn't care. They treated me awesome. It was an awful experience, but it was also a pretty remarkable experience because I'd have never thought anything like that could happen with the COVID leading up to that point. I thought, nah, it's bad, but I can just stay at home, take some Tylenol, and I'll be good, right? That's not it. The biggest thing that I told everybody, friends and everybody, because, there was a lot of them were similar to me, like, it's COVID. And when this happened, it humbled a lot of us. I mean, it's a lot more humble than we are. It doesn't care who you are, what you think, or anything like that. COVID is a bad thing. And when it gets you, it gets you. And it's going to decide how bad it gets you. You're not. I didn't know I was that close for a lot of that time to not being around. And when you start thinking about it now, it still gets me.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.